Good evening, guys. My name is Onyekachi Umendu, and you're again welcome to our having conversation around the COVID-19. It's been pretty amazing how our conversation has gone around um, um, health, how it has gone around politics, how it has gone around entrepreneurship, post-COVID COVID-19, and how we can begin to prepare ourselves. Today, I have a guest who's going to be joining us from the UK. He's going to be sharing on healthy lifestyle that will aid the survival of COVID-19. I'm going to, as much as I can, help us in such a way that we are going to narrow it down even to our personal lives, and also going forward, what we need to begin to do in order to avoid the spread, avoid being around those who are also infected with the virus. All right, so our guest today is Dr. Nzeh. Dr. Nzeh is online. Let me quickly add him up so we'll get right into it. Okay. By the way, Dr. Nzeh is a medical doctor. Okay, they call them general practitioner in the UK. He's going to be joining us in a bit.
Hello.
Hello, sir.
Hello.
Yeah, good evening, sir.
Good evening. I'm not sure if the video is it meant to be video?
Yeah, it's meant to be video, sir.
Okay. Let me see. I'm not sure why it's not showing. Can you see
Yeah,
my video?
I can.
Okay. So hello. Nice to join you guys.
We can't see you. I don't know if my audience can. I can only hear your voice. I can't see you.
1 second. 1 second. I'm not sure what's happening. Okay. How do I? Because I've not done this before. Is there any
Um,
specific thing?
your phone has to be in front of you. We need you to use your front camera to be able to connect with us.
All right. Okay.
Camera
1 second.
of your phone. Yeah.
1 second. Um,
Your front camera needs to. So let me just end it and re-add you back. I think that will be fine for us. Please bear with us. Our guest is not. I think he's not getting what he needs to do. Let me re-add him back. So what's up, guys? How you doing? Okay, he's trying to reconnect again. He's trying to reconnect again. He's trying to reconnect again. Hello, sir.
Hello.
I don't know. It's not showing. I don't know if my guest can hear you. That will determine if we'll continue. I don't know. Can you guys hear us?
Hello. And they hear. If you hear,
Yeah,
just put a comment on the
yeah,
tab below so I can know. Oh, I can
yeah,
emoji or something.
yeah. Me, I can hear you clearly. The only challenge is I can't see your face. But I don't know if you can see mine.
I can see yours. I can see yours. I'm not sure.
Can you guys hear us? I need you guys to comment at this point so that we'll know whether we'll continue, please. If you're online, please let us know.
Right.
All
Okay,
right.
that's fine.
All
Yeah,
right.
yeah, I think they can hear me. I'm not sure why the video is not showing, but
Yeah.
maybe.
If they can hear you, I think we should just get right into it. Good evening, doctor.
Hello, thank you very much. Sorry, thank you. Hello.
Yeah.
Yeah.
So, I don't know, healthy lifestyle that will aid the survival of COVID-19. I don't know if you can give us more insight into this particular topic we pick. I'm sure questions are going to come out as a result of our conversation going forward. Well done,
All
sir.
right. Thank you very much. Thank you for your time. Thank you for giving me the opportunity to share my thoughts. Um, I believe this situation at hand, the COVID-19, will be more of a difficult time for everyone and very challenging for most of us as well. And
Absolutely.
as we're trying to adapt to these changes, obviously most of us haven't encountered such situation before.
Yeah.
Um, it's a it's a bit of a challenge, and most of us might struggle to cope with it. I've put forward some very useful tips about healthy lifestyle, which I think most of us know or we have heard one way or
Yeah.
the other about it. But because COVID-19 is still very new to us, there are a few things, there are lots of things going on around in the internet
Yeah.
about what would help, what wouldn't help, what to do, what not to do.
Yeah.
My own knowledge, I'll just simply share with us today what I've put down as tips to help aid survival and also basically not only aid in survival but reduce the spread of
Okay.
COVID-19. Okay. First and
Yeah.
foremost, we talk about healthy lifestyle. Um, it's simply, the healthy means healthy, living life to its fullest, being healthy and strong, being able to carry on with our day-to-day life. And lifestyle basically means everything around us, basically.
Yeah.
The way we do things, the way we interact, the way we um, uh, carry on our day-to-day lives. So basically, adapting a healthy lifestyle simply means healthy living or living healthily. So it generally includes, in context of COVID-19, adapting a healthy lifestyle includes all things that we do to reduce transmission of the virus. And
Yeah.
if we are infected or if we are potentially infected and we don't know how to reduce transmitting it to others,
Yeah.
um, and also things that we can help with that can help us, help our bodies cope with it just in case we are infected.
Yeah.
Okay. I believe this should be an interactive section, so feel free to ask questions as we go.
Absolutely. I'm definitely going to do that. Yeah.
Yeah, yeah, okay. So I believe we've all heard about social distancing. I don't think it's peculiar to the UK. I'm sure also in Nigeria and around the world, we've heard about social
Yeah,
distancing.
we've heard about social distancing, and a lot of us have the opinion that social distancing is not something that is very feasible in Nigeria because we live in a more like a communal setting in Nigeria.
That's
Um,
right.
so social distancing is a little bit I don't know how possible that is, but we just go ahead. Maybe in the course of the conversation, I'll also
Okay.
share my thoughts on that as well.
Okay, that's fine. Okay, yeah, because it's such an ambiguous term, social, and then distancing. You simply,
Yeah,
if you look at it in looking at it from what it means, from the way it's sounding, it sounds like, yeah, just staying away from each other,
yeah,
distancing yourself. But it doesn't actually mean that. What it actually means is just things that we do to reduce social interaction between
yeah,
people. The
yeah,
ultimate aim is to help reduce the transmission of the coronavirus. Um, I think yeah, it comprises of a few things, which I'm going to mention now. I'll just try
yeah,
to keep it short and simple. First of all, the first thing about social distancing is to, if we know someone who's got the virus, the first thing is to try to avoid close contact.
yeah,
So that's number one step of the one of the measures of social distancing. If someone has got a new cough, a fever, probably lasting more than a week or so, and you suspect this could be corona, I mean, where I work now, anyone who's coming with a fever or cough basically is COVID until proven otherwise.
Yeah.
So, so basically, you try as much as possible. If it's in your household, it's just a step. I know it's difficult, but try to avoid anything close contact. And what I
Yeah.
mean by close is by coming very close. Person is talking, you're right in front of him, or sharing spoons, cutleries, all those sort of things with someone.
Yeah.
So first step. Um, the second step would be to try as much as possible. I know it's difficult in Nigeria, but some people use I mean, public transporting is another thing,
Yeah.
here is avoiding unnecessary use or non-essential use of public transport as when possible. So if
Yeah.
you don't have a need to go out, or if you
Stay.
can walk to somewhere, it's better you walk rather than going in a compacted, highly um, crowded bus or something. That's
Yeah.
another. And then if you want to use a taxi, that's fine. You can use an Uber or something, and it's just you and the driver, which of course you would need to be at the back seat, and then kind of a bit of distance from the
Uber
driver.
or something.
And then
Just you and
for
the
us,
driver.
for those of us who work, working from home is an option. I'm not sure if it's an option in Nigeria, but it's a very good
It,
option here.
Yeah, it is an option in Nigeria. Quite a lot of us are working from home. In fact, we're also on a lockdown, so a couple of other people, couple of people are working from home, while some essential workers have to go to work. But quite a lot of people are actually working
Okay.
from home.
So that's very similar to us, actually the same of what's going on here. So that's another measure of social distancing, and that's why they have said if you can work from home, it's more preferable than going to the workplace, just to reduce any chance of contracting the virus or transmitting the virus if you have one.
Yeah,
Another thing is, which is very difficult, is avoiding, because we Africans, I do know that we love celebration, we love parties, we love our weddings and stuff like that.
yeah,
Um, Avoiding large and small gatherings in public places. It's one of the measures of social distancing as well.
yeah,
So, however possible, we try to kind of limit our gatherings. Nowadays, no parties are happening anymore, no weddings, nothing is going on in this place.
yeah,
Uh, so, because it's been found out that when a lot of people are compacted within a small environment, there's a high rate of transmission of the coronavirus if someone has it.
yeah,
And from the WHO data, it says that if one person has it, there's a chance that he can transmit to at least two or three people. So
yeah,
that's the chain of spread. So avoiding that gatherings will be helpful in terms of limiting the spread and transmission.
yeah,
Also, I know we are quite religious in Nigeria and in Africa in general. Churches and mosques and all those sort of things are actually at this moment discouraged, unfortunately. Um,
yeah.
there is a chance that they can be like online kind of remote um,
Services.
services that would be really preferable
Yeah,
than physical, visual face-to-face gatherings.
yeah,
Uh, Another difficult one is also they have discouraged even gatherings with family and friends,
yeah,
and as a measure, because if you have an elderly relative or a dad or a mom who is in 70s or 60s or thereabout, they are vulnerable,
yeah,
and there is a chance that if you as a young person is probably has it and doesn't know, maybe you haven't got the symptoms, you might easily get it spread across to these ones. And the
wow,
vulnerable ones are the ones who are actually, unfortunately, having a high fatality in the world. So we encourage use of phone, internet, social media like this to
yeah,
help
yeah,
touch rather than gatherings. Yeah.
yeah. Awesome, awesome.
Sure. Yeah.
Okay.
Yeah, I've got a few more things. So we talked about social distancing. Another way we can encourage healthy lifestyle is by hand washing. I know we've heard about hand washing all the time and
All the
hygiene.
time. Yeah, yeah,
And we go online now, everything's about COVID. There are lots of posters and videos about techniques to wash the hand. And I'm sure
yeah.
we all have come across one or two of them. It's basic,
Absolutely.
yeah, it's basically the same. The teaching is that the virus, it doesn't. It's like every other virus, so it tends to be contracted. You can, if you touch something that is contaminated, you can just have it at your hands, and they can stay in the hand on the hands for so many hours, sometimes even a couple of days. So we encourage that as much as possible, 20 seconds, just 20 seconds at least of what thorough hand washing with soap and water. Um, we say soap and water because the virus has a fatty kind of surrounding. So if you look at it under the microscope, it's got a lipid, or what we call fatty layer around it. So if you use water, the water might not actually break down that fat. And as long as the virus is enveloped by that fat, it's very, very effective. So if the soap comes in contact with that lipid layer, it dissolves it and enables the virus to be easily, dead, kills it off. So at least as many times as possible, you wash your hands. There is no limit to the number of times, but at least 20 seconds thoroughly washing the front and back of your hands. There are a lot of videos online for that, and also use of hand sanitizers
Yeah.
for those who come in contact with people. Maybe you shake someone and you don't have you don't have opportunity to wash your hand immediately. You can use a hand sanitizer. So it's best to have one handy.
Yeah.
Also, when coughing and blowing your nose, you make sure you use tissues just to trap it off, and then bin it straight away and put it in the bin
Yeah.
and wash your hand after that.
Yeah.
Okay. So generally avoiding touching our eyes, nose, and mouth with our unwashed hands. Also trying to cover, like I said before, cover your nose when you sneeze, and also use of disinfectants to clean surfaces that are more frequently touched, like the tables and chairs, the door handles, and all that. They can be thoroughly cleaned with disinfectant at least once a day. And these things to prevent transmission and spread and contamination and contacting the virus as well.
Awesome.
Okay.
It's interesting because it's some of these things that we are being told now, washing of hands, those are personal hygiene. Like for those of us growing up, these are part of the things they taught us in health science.
That's right.
These are things that we're taught, but it's unfortunate that we're in a situation now we now have to learn it like all over again. People now need to begin to adopt this method, and I have a challenge for me personally when it comes to we in Nigeria, because a lot of people still didn't take this virus as serious as those in Europe, because a lot of them felt that sun can kill coronavirus, so all they want to do is sit in the sun. There are some myths about this virus. I don't know, you're going to also help us. People feel that drinking a lot of chloroquine can help us fight the virus. Some people have thought, I actually watched a video on channels. A guy in Ireland who got the virus, and after a while was also confirmed that he came out negative after a while. And they were asking him how was he able to combat this virus while he was in the isolation center. He actually made mention of a few things, how he was taking ginger and garlic, paracetamol every 4 hours. Some of these things are what I wanted to kind of show, throw a bit of light, so that people who are watching can also know that, beyond knowing how to wash your hands 20 seconds with soap and hand sanitizer and water, using hand sanitizer and the rest of it, how, say for example, somebody has it, somebody knows somebody who has it, as much as we don't encourage self-medication, but before the NCDC people can get to whoever has it, what is this person supposed to be doing so that he doesn't probably not survive it at the end?
I understand. Okay, yeah, that's a very important question. At the moment, because this is quite new, they call it novel SARS-CoV-2 virus. So it's new to us, and the thing is that the virus is still being studied and presents in different ways. Now, some people, we all know that the commonest symptoms are fever, cough, and
Yeah.
some people also have breathlessness, feeling breathlessness, but they can also present in lots of different ways. Some people come with sore throats, could be headache, it could be tummy pain, it could be diarrhea, it could be vomiting, so lots of things.
Yeah.
Now, if someone there at the moment there is no specific treatment for this virus. There is lots of research going on at the moment in different countries of the world. People have tried lots of different things. I do know about the chloroquine thing, which of course they have tried in the US. I think the US, in the United States, they're using it quite a lot. A hydroxychloroquine with an antibiotic. They use it and most people seem to have recovered from that. But if you do notice that there is also people dying as well, there are people dying. It doesn't mean
Yeah.
they're not responding to the treatment. It's just because there is no specific treatment. That's the problem. That's the dilemma. So we're all faced with that dilemma. Here in the UK, we are not using chloroquine. Not that I know of. What we do use is, which is generally supportive treatment for people who are COVID positive or who have the disease, and try to encourage. So in the early stages, if someone comes with a fever, we assess them. They have a temperature. We check their observations. Their oxygen levels are still in the normal range. We'll ask them to go home and support themselves. And the way they can do that is by just generally taking paracetamol for the temperature, drinking plenty fluids, eating healthy. Now, eating healthy, there are no specific foods that have been found similar to medications that can boost your immune system. But people can try lots of different things that they use for other cold remedies. So if someone has a common cold, like influenza virus or any of those viral colds, the same treatment is what we do encourage. But if things are getting worse, they can always come back to hospital. Now, we encourage healthy things. There are lots of vitamins, fruits and vegetables. In Nigeria, we're blessed with a lot of leafy
Yeah.
vegetables,
Yeah.
lots of foods like beans, the nuts, the vegetables, the oranges, anything citrus, lemon. I mean, lemon, ginger, garlic, people have said have done lots of wonders for common cold, and it can still
Yeah.
help maintain. It doesn't boost your immune system, it just maintains your immune system to function at the highest range. So it just makes you feel the body to fight the virus quite quickly in the way it should. We do encourage people to eat health, so even if you want to snack, especially now that we're in isolation quarantine, if someone has got it, the best thing is if you have a temperature, you obviously need paracetamol. Take it every 4 hours, 6 hours, and then take plenty water. Drink plain water. Not We don't encourage sugary drinks or anything like that because lots of studies are going on. People have found that sugar can be boosting mechanism for the virus to spread around within the body. So fruits and vegetables, healthy snacks like groundnuts, beans, yogurts, those sort of things, and even boiled eggs. Those things have been found to be very helpful in maintaining your immune system. So chloroquine thing, I cannot say it's helpful or if it's not, but people have tried it in different countries and it seems to have done some work for them. But in the UK here, and I guess in Nigeria, I don't know, the UK here, they don't use it because it's not been approved. And you also remember that chloroquine, if it's taken in a very high dose, it can cause lots of problems to the body as well, what we call quinine toxicity. So it can affect the heart, it can affect the brain, it can affect the eyes as well. So bearing that in mind, we should be able to be cautious about that as well.
Yeah, I think I also heard that they started using antiretroviral. I don't know if I'm right.
Yes.
Yeah, that's what they use for HIV. Yeah, am I correct?
Yeah.
I also
So
heard, I read somewhere that that is also like a little bit effective for those who are now confirmed, who are confirmed cases of the virus.
yeah, so all these things have been used in the United States. So they use lopinavir, some antiretrovirals. I think a couple of them have been tried to, potentially see if it can combat the coronavirus. It's there are no specific data to say, okay, this is the number of people who have been tried on this, and this is how they have done so far. they have recovered. But at the moment, I would say everyone is just trying anything they think could be helpful to
Yeah.
them.
Yeah.
In the United States, they do try the chloroquine, they've tried the antiretroviral, they've tried azithromycin, which is an antibiotic. And it seems like you hear lots of people say, oh, I tried it and it worked for me. Some other people may have had the treatment and it doesn't work for them. So it's a very, very tricky one, you know. And at the moment, not until we get the correct, all the things
Pass
studies are
out.
done, yeah, the correct treatment, then we won't say, you know, this is the treatment or this will work for this person. And, you know, what are the chances are there is a chance it can work for someone. There is also a chance it may not work for the another. So I
Yeah.
think the big thing is to allow your body to fight it. And if you need support, because most people who are whose bodies are not able to fight it properly, they may notice that they will be going down quite quickly. They start becoming short of breath. And those are the kind of ones that need to be in hospital to be ventilated and
Yeah.
support their breathing so that they can recover while their body fights, to support them while the
Right.
body fights the virus. And
Two things I want to ask. You know, you talked about human system, and you talked about maintaining and boosting. You know, for a
yeah.
lot of people, they feel that if their immune system is well boosted, it will help them fight this virus.
Mm-hmm.
Yeah. And you also mentioned that, okay, granite, boiled egg, some of these things, ginger and garlic. Okay, ginger and garlic maintains them, not like they
Yeah.
boost the immune system. Now,
Yeah.
granite, for example, the reason I'm asking this question is because for me, at this point in time, as much as I love to chew granite, I used to have it a lot in the house. But right now, I'm not sure of anybody, unless I'm going to be the one to fry it. Now, because at the moment, as much as I want to stay safe, I don't know who. I might enter a store and decide to buy granola, but the thing is, I don't know who did it. I don't know if the person was listening to this whole thing about washing of hands and all of those things. So nobody at this point in time wants to just risk that. You get what I'm saying? So are there other things aside from these other things that will help people boost their immune system, as much as we are also trying to avoid going out? We are trying to, as much as we can, stay in the house, do what we have to do from the house and not go out. What are those things that we can do from the home front that will help people boost their immune system?
Okay, so like I said earlier, it's very difficult at the short term to boost your immune system in a short period of time. So the immune system is something, or the body defense mechanism works over time. So that's why we use vaccines. You know, when we're during the childhood time, we do vaccinations. So they vaccinate our newborns and childhood and all that. The essence of those vaccines are to help your immunity, to help your body defense mechanisms to fight viruses or any of those killer diseases that existed at that time. You know, so you have the right fighting, but it's just like someone coming into, like when you play the game of chess and things like that. You've got the
Yeah,
knights, they stand at the wall, you know, they fight. So those
yeah,
are the specific fighting soldiers you've got to fight any particular disease. So for coronavirus in particular, there is nothing you would do at a short period of time to put up your immunity over 100% to start fighting coronavirus. Now, it's something that has been built over time.
yeah,
So if over time someone has got no medical problems, no diabetes, no, is not obese, is not having any medical challenges at all, and then he's eating at the same time, he exercises, he eats healthily, and also he doesn't smoke, he doesn't drink alcohol and all those sort of things. I think such people have stand a better chance of fighting the virus when it comes, rather than just, just start on the short a sudden start eating ginger and all that stuff. Okay, those things,
yeah,
they have the way they work. Like for instance, if someone comes and has a sore throat, or notices that I'm beginning to have a bit of sore throat or something, and then you start taking ginger and garlic and onion lemon tea and all of that, that can help. Now, what those things do is they just help your body cells get to a certain level so that they won't be overwhelmed by the potential virus. So it's maintaining it at that level. If they don't do those things, the immunity might be like still where they are, but a bit less strong. too easily. It's just
Yeah.
like being alert. So being alert is what we're doing here. Your body's
Yeah.
alert mechanisms has been built up over years. Okay. And as soon as the virus is coming, it doesn't have a clear way to bind because your body mechanisms are different. They're very healthy. And even if they bind, because your immunity is working at the level they should, they just fight it and they don't overwhelm it. They don't overwhelm the virus cannot overwhelm your body. So while you talk about things you can do at home, it's just things I've already mentioned here. Like those things, eating healthy, exercising at home,
Yeah.
not being exposed to people who have it. Okay,
Yeah.
because if you have a high viral load, it's just like HIV. Okay, someone might have a very low viral load. So what does medicines, antiretrovirals do when someone has got HIV is to reduce the viral load. Because viruses come in, they multiply. And when they multiply, they have this tendency to overwhelm your body. So if your body's mechanisms are to a certain level and the virus cannot multiply, then that gives you a quicker chance of recovery. So you'll be able to recover very quickly, and it won't. That's why they say most people have it and they don't know. They don't have symptoms. It's because their body is just coping very well with it and fighting it gradually without them knowing. And someone who's been very poor in health, maybe is elderly, has got one thing or the other, high cholesterol, diabetes, other sort of things on the background, or a lung problem like asthma or a lung problem due to smoking, what we call COPD. They easily get overwhelmed. So once the virus comes, this is a very conducive environment. It multiplies very quickly, and the next thing it just takes over the lungs. They have this very nasty pneumonia that happens in COVID. So that's the thing. So it's all about just helping yourself as much as you can, eating the regular vegetables, fruits, drinking water, keeping healthy, staying away, and maintaining all those social distancing precautions. I think we'll get there if we all do this. Um, uh, yeah.
Yeah, I'm going to ask, in the issue of social distance, for us in Nigeria, like I said earlier, we are more of a communal people. We live in communities, we live close to ourselves. It's not like there are areas in Lagos where there are no blocks of flats. People live in a face me, I face you kind of houses. People share the same toilets, maybe like 10 tenants sharing the same toilet, 4 tenants sharing the same toilet and bedroom, knowing that there are door knobs to this and all of those things. What will you advise,
Mm.
in situations like that, knowing that this, as much as we know, is not safe for a lot of those kind of people? What will you advise?
Okay. I know it's a very difficult situation in Nigeria, like you said, and it's that's the reason why we pray it doesn't come to Africa or Nigeria as it is here, because it's gonna be we pray it doesn't happen, though it's gonna be very difficult to manage. um I think the best thing to do in this situation is, um if someone is very poorly, for instance, if let's say for instance you're living in a face me I face you apartment, or even sharing accommodation with a group of people. If someone has got the symptoms, it is best. That's why it's good to educate these people. It's best to stay indoors. Now, the people around them can help them by supplying them with their needs. For instance, if you share a bathroom, okay, with other people and someone has got the symptoms, the best advice, the recommended advice is, if you're sharing a bathroom or toilet, what you need to do is either you're the first to use it, so when you use it, you wash after you've used it, or you're the last. So it's either way. You can't be in the middle, because if you be in the middle, you're going to infect those after you.
Yeah.
Okay. So it's recommended that if you use the toilet, you wash it, and if they're sincere to themselves and really want to prevent spread, if they do that, that would help a lot, reducing their transmission. So if they use the toilet, they use it first of all in the morning, or they wait for every other person to use it before they go in. And after that, they should tidy up, like wash it, give it a rinse or wash it properly. And that's it. If they need to share kitchen, they use the same way as well. You make sure that no one else is there while you're doing your cooking. And once you finish, you tidy up, you go into your room. If you need basic necessities, you can appoint someone who's a friend or something, can get those things for you. You can you can bring them to your door. Maybe if you need to buy something in the market, they can help you buy it. Just drop it at the door, and all you do is open your door, take it in. And keep in touch with the phones. Everyone has got, almost every household has got a phone in Nigeria now. I don't think it's anymore luxury anymore. So use your phones to communicate with people. There will be people who are able to support. When they see that you want to reduce the transmission, they'll be able to help you get these basic things. So that's where education is very important. Enlightenment about how to prevent spread is important.
Yeah, I think that's what our government needs to do more. As much as these awareness are going on, it's more with the elites. I think a lot of people living in the slum, a lot of them don't really know what's going on. So for them, they are still living their normal lives. They are still, what they will still tell you that this thing cannot get to us. And my prayer is it doesn't get to them, because because the whole corona thing getting into Nigeria is for those who travel a lot, who go in, go out. Some of these people have got no passport or any traveling history, so they are just in their slum, and this whole thing is coming to them. So one last question I'd like to ask you is around the response of the UK government towards the fight of COVID-19.
Okay. When you say response, what do you mean?
In terms of medical response.
Okay. Yeah, I think there are lots of things going on. I mean, it's a very difficult decision to make when you have such challenge in every economy. In every country has its own way of tackling pandemics. Some of them haven't encountered pandemics. I mean, this modern generation, I don't think anyone has seen a pandemic before. So the response might be difficult. I mean, lots of people are saying that the response here was a bit slow and all that. But I do understand that it's very difficult to make such very big decisions, because it's going to affect the whole people. It's going to affect everyone. Some people will be happy. Some people will not be happy. So I think the response, to be honest, was timed and calculated, I would say. I know if you compare the UK generally to some of our neighbors like Italy and all that, they may have responded very swiftly, but then the situation is still very much more worse than it is. And one thing that I've come across to know is that they say the coronavirus, I don't know how true that is, to be honest, it's still under evaluation. The coronavirus has got different strains here and there. So the strain in China might be different from the one in Italy, might be different from the one in the US. So that's where the problem is. We don't know if it's true or not, because we do see the same virus causing lots of typical damage in different parts of the world and very minor damage in other areas. So could it be a different strain? Could it be the response? Could it be the population? Could it be the people's response to do it? So I think the UK was timed and calculated, and as such, the government is trying to be very supportive to everyone, and it's just people's orientation is different here as well. Some people have the same mentality Nigerians have. They say, "Oh, it won't come to us," but at the end of the day, we all have to take those measures. And I think the government are doing all they can to support us working in the front line, and even the general population at large as well, to help reduce spread and bring down the deaths that are happening on a daily basis.
Thank you very much, sir. We are going to take questions from our online guest. Somebody asked, the person is asking, Mr. King Bogoremi, he said, what about the vaccine theory?
Vaccine theory? What's...
I don't understand what that means. He said, how about the vaccines theory? I don't understand what that, unless he's going to put that question in a better perspective for understanding.
Okay. Maybe he's talking about the vaccines that are being Is there anything about vaccines that have been done at the moment? Yeah, as we all know, there is lots of vaccines that have been developed in different parts of the world to combat COVID-19, and there has been a lot of speculations, initially about links with the COVID-19 with some kind of it was man-made and all those sort of stuff. Lots of things are going on at the moment. I can't comment on for certain that this is real or this is not. But all I do know is that lots of vaccines are being made up for to see if they for coronavirus. And obviously, as we know, vaccines take time to come up. They take time to get licensed to be used in the general population because it needs to be safe. The side effects profile have to be clearly known by everyone, and it has to be very, very, very safe. So as much as those things have been developed, when they do come out, it's still going to be provided, it's still going to be put into, as one of those regular vaccines. If you want, you can have it. I don't think it's going to be a hard or fast thing, to be honest. I don't think it's going to be you have it or you don't, or you leave or what. I don't know. But I do know that it's going to be one of those vaccines that there will be criteria for people to use. So especially those who are elderly, it might be made mandatory for them, because of the chances of being more dangerous when this in the elderly. So it might be made mandatory for the elderly population, or I'm not sure how that will work, but we're just waiting and seeing. Also, it says, is there any vaccines for COVID-19?
Yeah.
Okay, so, all right. So there are lots of studies being done. Like I said earlier, there are still because vaccines to be released, they have to go through clinical trials. So, and the clinical trials have got various phases. So you've got the phase 1 up to phase 3 or 4. And these things go through very intensive screening. There have to be people who volunteer to have them, and then they'll monitor them for a period of time. Earliest, I do think there is, I read in a paper yesterday or so, the vaccine might be available by September this year.
Wow. September is a long time.
Well, September is the closest, to be honest, because it takes an average of about 2 years or 3 years for a vaccine to be brought out to be routine used. So this is the quickest they can do. Some people are saying by mid next year even. So I don't know how things will play up, but we are hoping that, we're hoping that it comes out as soon as possible.
Yeah,
there's no current vaccine for it.
We hope this vaccine comes out as soon as possible, because a lot of us are beginning to get very scared. Not scared that it's going to come to us. The more we hear all of this news about death here and there, it begins to make us feel like people are just dying like chicken. All right, so somebody is asking, does alcohol intake reduce the chances of contacting the COVID-19 virus?
The general teaching is consumption of alcohol has not got anything to do with coronavirus. And taking alcohol does not reduce the chances of taking it. That's what I do know. Because there are no chemical studies that have been found that alcohol reduces the chances. At the moment, no studies have been established or concluded to say alcohol is a protective factor. No. So the general teaching is reduce alcohol intake, reduce smoking, or if possible, quit, eat healthily, and that's it. Because the chances that someone might just have this misconception that, alcohol, I should consume a lot, and you end up damaging an organ like the liver, which is worse than corona itself. That the chances of that happening is quite high. So we do discourage people from just assuming, and as much as no studies have been found to be protective, it's best to just be sticking to the regular recommended weekly allowance of alcohol.
Yeah, so but then again, alcohol in terms of I know part of what they use for hand sanitizers, their alcohol as part of it? Like, I don't know what's the percentage, because a lot of people started having alcohol in their houses. They use it as disinfectant. You know, they use it to wash their hands. They use it to, you know, because at the point people started making hand sanitizer, they went on YouTube, do it yourself. They went on YouTube, got all those, and started doing
Sure.
hand sanitizer. So it's a case of I'm sure it's beyond people taking the alcohol intake. How about in terms of using it as disinfectant and all of those other things?
Very good question. Very good question. Alcohol, yes, is a component of most of our disinfectants, especially the hand sanitizers. They do have this methyl alcohol in it, and that methyl alcohol, it's very is a very strong chemical that this can disinfect. So it can break down the walls surrounding germs, generally all germs, both bacterial, viruses, and all that. Now, don't forget that apart from alcohol, there are other chemicals that are supposed to be used. So apart from the homemade ones, of course, people do use alcohol and aloe vera and all the stuff. They mix them up, they make their own hand gels, because aloe vera has been found to be a natural kind of a natural substance, contains a natural herbal remedy, I would say. Okay. Now, those other chemicals that are made from the industrial hand sanitizers have their own peculiarities. And those chemicals specifically work on certain viruses or certain organisms or certain germs. Okay. Yeah. So if we do use that concept of saying, oh, generally it's the alcohol that is killing the germs, it could be, but then it may not kill the germs when it goes into your body. It might kill the germs when they're outside the body, but it may not do the same when it's inside your gut. Okay. So that makes it a bit tricky, because what's happening inside your body is not the virus walking from one point to the other. It's the virus multiplying. So the virus may not stay and start crawling from one bit. No, it doesn't do that. What it does, it enters your cell and starts replicating, starts building, getting into multiple numbers. And the alcohol you consume may not be able to stop them from doing that. Okay, so I wouldn't use that concept.
I'm sure you answered that question for that person. Okay, the last question we're going to be taking as we round up. What advice do you have for the Nigeria Ministry of Health? This question is from King's Place Double Shop. Last question.
Okay. I've not been following closely what's happening in Nigeria, unfortunately, but what I do know is that Nigerians are doing quite a lot in their own interest, in their own way, to, of course, to help prevent spread and stuff. But at the end of the day, knowing what Nigeria is all about and how our response have always been to things like this, the Nigerian government have taken this, the Ministry of Health in particular, have taken this coronavirus very, very seriously. But as we know, the corruption above the Ministry of Health might not enable their plans to actualize.
Yeah.
So because we hear about very reduced number of cases in Nigeria compared to other African nations. We hear about very minimal deaths in Nigeria. But one thing I know is that the numbers of positive people are so many in Nigeria, but it's just the screening hasn't gone round. Now, if you think about Ghana, which is just our neighbors, Ghana have done like, I'm not sure now, they've screened up to about 15,000 or thereabouts, or even more than that. And they have found lots of positive because their screening is so widespread.
Yeah.
But in Nigeria, I think the screening is very poor. So I would advise the Ministry of Health to be very, 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 take it on board. I mean, there is nothing, the COVID-19 is just something very scary. It's very scary. People do recover from it, but it's still very scary because not much is known about it. And if you look at the numbers of people who are dying all over the world, it's just something that you would want to just switch off your TV and not want to hear anymore.
Absolutely. Absolutely. I don't want to follow those news anymore. All right. Thank you very much, Dr. Nzeh, for joining us. We are glad that you were able to join us. I'm sure the only thing is we didn't get to see your face, but because what we intend to do at the end of the day is to upload this video on YouTube, it might be helpful for a lot of other people who might be looking for question along the line that we have gone today. Thank you very much, sir. We are grateful. On behalf of King Ogwemi Foundation, we want to say a very big thank you to you for joining us today. Thank you so much, sir.
All right. Thank you. Thank you. Bye-bye. Thank you for the audience. Yeah. Bye-bye.
Yeah. All right, guys, I'm sure you've learned a thing or two. It's been an interesting conversation. I really enjoyed myself. I also learned a couple of things. So basically, boiled egg is very fantastic for boosting your immune system, just like the doctor said. Granite, for those of you who can make, please do well to and make a home. So it's been an interesting conversation, no doubt. I had fun having that conversation with Dr. Nzeh. I'm sure you two also had the same, also had fun as much as I did. So thank you very much, guys. Our next live video will be on Monday. Our next live video will be on Monday. We might come up briefly tomorrow, but our next major live video will be on Monday. We are going to be doing Monday, Wednesdays, and Fridays, just to also prepare ourselves for these conversations. Thank you very much, guys. Thank you, Omo Flaky. Thank you, Oge, for joining. Thank you, King's Place Barbershop, for joining. Thank you to Mama T for joining, and thank you to every other person who joined this conversation. Thank you so much, and God bless you. Have a wonderful weekend. Bye-bye.